All right, in the interest of time, maybe we'll go ahead and get started. It is being recorded, so anyone who comes late can grab the recording. Thank you all for joining us today for this talk. This is actually the first in the clinical research seminar series that is being developed and organized by the Clinical Research Workforce Development Program, which is led by Haley Steinert and Tricia Gesualdo, who are here today. We want to thank you for attending. If you have ideas for future seminars, let Haley and Tricia know. This one is titled The Research Contracting Process at CU Anschutz, and we're very fortunate to have two leaders in our research contracting process with us today to present about this and answer questions from the audience. TK Keith is the Director of Pre-Awards Contracting Fiscal Compliance with the Office of Grants and Contracts. He's been on campus for a decade. And then Christine Ahern has been on campus for, I think, 22 years and is the Director of Regulatory Compliance. So she oversees clinical trial contracting, MTAs and CDAs, as well as the Privacy Office and Conflict of Interest Office. And with that, I will hand it over to Christine and TK.
Hello, everyone. Thanks for joining. Excited to see there's so much interest in the topic. As been said, it's something I've been doing for the last 10 years. So certainly something that, I like to talk about. And, the more kind of understanding there is in the research community about this process, I think the better for everyone. So when it comes to questions, feel free to jump into the Q&A with questions. We'll have some folks that are looking at those and trying to answer as we're going along. But certainly we can look at have some time at the end for questions as well. So to begin, I want to start off with kind of a high-level view of the contracting offices and the different types of contracts that are processed on campus. So we're not going to go into all these today. We're going to focus more on the research-related topics or contracts, but it is helpful to kind of see that there are many different offices that do contracting, and each of them have kind of distinct contracts they handle. So to start off, we have financial services and OGC. So OGC sits within financial services. This office is going to handle any type of agreement for a sponsored project, including sponsor research agreements, but excluding industry CTAs. So that's kind of one key to remember and something we'll go into more detail on later on how to distinguish those. We also handle outgoing subcontracts, fee-for-service or revenue agreements, and then equipment loan agreements. The CRAO office, under regulatory compliance, handles those industry-sponsored CTAs that involve human subjects. They also handle MTAs and then CDAs or NDAs. CDAs and NDAs are the same thing. And then you have CU Innovations is going to handle license agreements, any kind of interinstitutional IP agreement. The PSC is going to handle any outgoing vendor or procurement agreements. Regulatory compliance will handle data use agreements, BAAs. CU Medicine will handle any member practice consulting agreements. So this is where a faculty member has a member practice agreement with CU Medicine and they're doing consulting. Those run through CU Medicine, which is also formerly UPI. And then the foundation and the Office of Advancement will handle gift agreements. So this is a flow chart that looks more complicated than it is, but is really, really helpful when you're trying to sort of start from scratch and determining where an agreement needs to be processed. It can be a little bit nuanced to distinguish between the offices. So this is something we put together. Again, if you're starting from scratch, you really don't know where an agreement should go. This is really a helpful flow diagram to follow. So I'll walk through this at a high level, and then we'll talk through the more research-related agreements in a little more detail. So to use this, you start the green starting place. The big thing that I always ask someone if they're not sure who should handle a type of contract is, are we receiving money or paying money to another entity? If the answer is no, then we're dealing with what we call a non-monetary agreement. So there's a handful of these. They're listed out. I won't go through them in detail, but those all have various offices they go to. If we are the ones paying money, then it's either going to be a vendor consulting agreement that's processed through the PSC. If we are paying for research, then it's going to go into one of two buckets. It's either going to be something that's funded under another sponsored project, which are your 30s and 31s. If that's the case, we want to know, is there going to be a site PI at the other institute? If there is, that would be a subcontract. If there's not, we would use what's called a practice participation agreement. I will say that the practice participation agreements are not as common. This scenario would really be where we are working with, say, an off-site clinic where there's going to be enrollment, say it's a clinical trial at a small rural clinic, but they don't have a PI on site. They don't have someone that would be in that subcontract PI role. If that's the case, we use the practice participation agreement. If we are paying for research and it's under Fund 34 or 35, which are our gift funds and internal funding, that's when we use what's called a research services agreement. The idea here is there is going to be a PI at another site or another university or entity, but with a gift agreement or internal funding, there's no kind of prime contract that we would flow down. And so it's kind of a different type of template we use there. But that's for outgoing money. If we are the ones receiving money, the first question we're going to ask is this a sponsored project, or is someone paying for a service on our end? If it's a service, we want to know if it's going to be consulting through CU Medicine, or is it something that is just another type of service on campus? For example, if we're running assays or something that we are not the ones performing research, we're doing more of a service, then we would handle that in OGC as a revenue or fee for service agreement. If it's a sponsored project, then the question we're going to ask is this human subjects research, and is it industry supported? And keeping in mind that industry supported could mean funding. It could also mean they're providing kind of in-kind value, like a device. If a industry sponsor is doing a device study and they're sending us the device, that's their contribution. We're studying the device on humans and then collaborating with them on the data that we're getting from that study. So those, as I mentioned, will be with the CREO office, and then everything else is going to be through OGC. When we're looking at human subjects, a few definitions here, but we're primarily following the NIH definition. So something to keep in mind, it's really that interaction with a living individual or about a living individual's data. That's where something's going to cross into that line of being human subjects research. That can be a little bit nuanced. So if you have questions about whether something crosses that line or not, just please reach out to either our office or the CREO office. We're spending lots of time every week looking and trying to answer those questions. So I'm happy to support there. For a little bit more of a definition for research just generally, here's, I think, a pretty good one. When we're talking about research, it really is that investigation or discovery of facts, trying to test out hypotheses, new theories, analysis, data gathering, experiments. All those things are what we would consider research. And again, looking at if the PI is going to develop any kind of new methods, are they testing hypotheses, or are they generating data to recommend the next way that a sponsor would want to go with a product or just research in general. And then, as I mentioned before, human subjects research can be a little nuanced. There is a really helpful tool, the links here, and I'll share these slides, and this is on the OGC website as well. But this is a really good cool tool that goes through kind of a decision tree for some of the more nuanced studies when trying to make that decision. So when it comes to the agreements that OGC is going to handle, here are a few just kind of tidbits about those. Really, the primary buckets, as we're calling them, are going to be those incoming sponsor projects, incoming fee for service, and outgoing subcontracts. Listed here are the team members on the OGC contracts teams, as well as the inbox. If you want to send in a question, we're going to go through kind of the submission process for contracts in a little bit, but here's kind of a good go-to address for any questions there. Also, a little bit of more definition around sponsor projects, fee for service, and subcontracts, and then the funds listed out that they go into as well. We've also listed out, you can see at the top, kind of where there can be some overlap or some grayness with which office should handle the agreement. So with sponsor projects, that's where, the question usually is going to be, is this human subjects research, should it be with OGC or should it be with CREO? And again, keeping in mind that that's only when it's industry funded. If it's non-industry funded, it's always going to be with OGC. With incoming fee for service, that's where it could be with CU Medicine. If it's a faculty member that has a member practice plan and they're doing consulting, that's when CU Medicine versus OGC. And then outgoing subcontracts, that's where, the grayness can be, does this run through the PSC as just a very standard PO vendor contract, or should it be a subcontract, or like I mentioned, the RSA and the PPA, and be handled by grants and contracts. This is really, I think, a helpful list of, a good example of all the different names you'll see with agreements, and really kind of points out, it's not about the name of what someone calls an agreement. It's really about the substance of what's happening in the agreement. Particularly because in our office, we are using a lot of vendor templates, and they're going to call, a certain agreement anything under the sun, right? I've seen clinical trials be called research services when it's really a full clinical trial. So it's really important. Don't worry about the name on it. Here's some names that, that are more common to see and maybe are a good starting point. But yeah, just really keep in mind what's happening with the funding, what are we being asked to do, are really the key questions to ask yourself when you're trying to figure out how to route a contract. And then I'm going to kick it over to Christine to talk about the CREO agreements and the Office of Regulatory Compliance agreements.
Okay, thanks, TK. So for clinical contracting, we're going to be handling anything that's industry related, human subject research agreements, and there's a handful of different types. Your typical industry sponsored clinical trials, the investigator initiated CTAs as well. Sometimes we do have clinical trial subcontracts. I don't know the frequency of that, but when those do come in, we have those terms and conditions that are really specific to clinical contracting. So it's important for our office to be involved. Compassionate use, these are all really some type, a subset of clinical research trial agreements. Confidentiality agreements, non-disclosure agreements. So those typically come in for clinical trials that faculty are considering participating in. It really gives the opportunity to look at the protocol and information about the project to make sure people want to move forward with it. Different types of amendments. Sometimes CDAs and MTAs, the material transfer agreements, will have amendments for them after they've been initially executed. Clinical trial agreements periodically have amendments as well. And then master CDAs. We do have a few masters for CDAs, and under that, there's different records of transfer for particular projects and protocols. Material transfer agreements, it's the transfer of something, of a thing. It's not just data, it's an actual, maybe a human subject like a blood or tissue, things like that. Typically, these are non-monetary. There may be a nominal fee associated with it, for preparing and shipping the material, but that really is all that an MTA should include with respect to anything related to funding. And we get incoming MTAs and outgoing. So we're receiving material and sending material on a regular basis. Whoever's getting that material is really involved in designing and participating in the research project. And then data sharing is yet another portal and entry into having an agreement reviewed. So the Office of Regulatory Compliance has oversight for data sharing. There's different types of data sharing agreements. We could have full PHI, which that's some set of 18 different elements of PHI that could be involved in sharing. A limited data set is specific to dates and elements of address. So a limited data set under the HIPAA regulation, the term DUA, data use agreement, is specific to sharing a limited data set. And then we have de-identified data sets, and that is when all 18 identifiers have been stripped from a data set so that the information is no longer identifiable to whomever is receiving that information. Business associated agreements, we receive these a few different ways. Sometimes it's with a procurement. So there's a purchase of a good or service. Maybe it's a medical record system or something else like that. PHI, protected health information, is going to be shared. So unless there's some type of caveat or carve out under the HIPAA regulation, we may need to put a business associate agreement in place for PHI that is being shared. Periodic, we're usually the covered entity, meaning it is our PHI that we are sharing. Periodically, we may have the inverse in cases where maybe there's a contractor granting contracts. Periodically, we might have a BAA attached to that. In addition, when we're doing BAAs and different types of purchases, there is a RAC, which is it's the research security group within the Office of Information Technology, OIT. They have an IT security review process when things are being purchased, goods or services. So that's another piece that has to be completed when we're doing a BAA for a purchase. We do have a specific REDCap data sharing request form. So this is a REDCap. It's basically like it's an online form where people can submit the data sharing agreement as well as provide us information about that particular project. Sometimes we don't have a template. If it's outgoing data from the University of Colorado, you may need us to use our template. Just, there's various pieces within that form where you can put any information that our office can look at when we receive that intake request. And then if there are ever questions, the reg compliance email is the best way to go about these data sharing agreements or BAAs. It's the reg.compliance@CU Anschutz edu email. And like TK said before, a lot of times we get various agreements that have one thing for a title, but really substantively are doing something different. So I do encourage people, if you have some type of data sharing request, you're not quite sure if it's truly just data sharing or something else, you're welcome to reach out to the reg compliance email and we can work through it to make sure we're getting it to the right entry point at the very beginning.
Awesome. Thanks, Christine. So, that's kind of a high level of all the different types of contracts, obviously the different offices that are handling them. But now we want to jump into kind of how do you actually submit something that has come in. I know we have kind of a variety of folks on the call, and really contracts do sort of come in a lot of different ways. I think a lot of times folks that maybe aren't typically routing contracts will just kind of get handed a contract and say, hey, can you get this signed for me? So here are the submissions, and I'll let Christine kind of talk through these, but starting with the CRAO office.
Yep, so there's the Human Subjects Research Portal. This is a submission that needs to be done for clinical research that is happening on campus. So that really is an intake process. It also kind of dovetails into the encore process as well. And I'm really not going to get into that as much right now. So that's really what that is for the CRAO process. We do get, I know later down, we do have contract amendments. A lot of times we do have amendments coming in through either the portal or Encore if it's an amendment to a clinical trial agreement. So there's a couple different ways those amendments for CTAs can come in. If you're not sure and it's a clinical research project, you know, CREO or the clinical research team has handled it before. We also have a CREO general purpose email, which you're welcome to contact. It's creo_contracts@ucdenver.edu. And we can work through it and get you an answer to really the best place for something to go.
Yeah, and then for grants and contracts, so there's a little bit of distinction for how you would submit something. We do have a proposal submission process. This is through InfoEd. This is going to be when you actually are proposing for grant funding, but we haven't received the agreement yet. And then also once an agreement comes in, that's going to be a first sponsor project, that's going to go through InfoEd as well. And here's a just kind of handy chart for the three buckets, as I called them before, for grants and contracts. I won't go through these in any more detail, but this will just kind of be handy to see what the intake forms are. It's really going to be either InfoEd or a form stack form, depending on what you're submitting. So something that does come up a lot are questions about the contract review process. What are we reviewing? You know, what kind of goes into the contract? And then F&A as well comes up as a big kind of question or topic that folks have questions about. So we'll dive into those. So when it comes to contract review, here are some of the key terms and conditions that our team and the CREO team are going to be looking out for. So publication, making sure we're protecting the faculty and PI's rights to publish. As an academic institution, that's very key to our mission, is making sure that, you know, a sponsor can't ask us to study a drug and then say, oh, we don't want you to publish on the results of that drug if we don't like it, right? So that is something that is very key. We do often have to fight on. In the rare instance, we're not able to have that right. That's something the Vice Chancellor of Research would need to process a waiver for. Data ownership and use, especially with European entities. This is something that has come up as more of an important and you know, detailed, nuanced topic as of late, particularly with things that the European Union are doing in terms of data privacy, but also here in the US as well. Also, just data ownership in general. I think the understanding of the value of data has increased, you know, more recently as that's been more widely available. So a very important kind of topic, something we want to make sure that we have the rights on our end, and something we'll oftentimes have to negotiate. Study monitoring and reporting. This is going to come up more in the context of clinical trial agreements, but also very important. Governing law and jurisdiction. So this is where another party has asked us to agree to the other laws of another state, let's be Wisconsin, or another country. It's to our disadvantage to agree to follow the laws of another state, and particularly another country. So that is something that can be a sticking point if a sponsor is requiring that we follow their law versus ours. For the most part, we're able to compromise and just remain silent. In that case, it kind of depends on where whatever's happening is taking place for what law would apply. But there are times where that becomes a sticking point, and that does require a waiver that goes up to our controller to approve. Intellectual property, also very important, and something that we're trying to make sure we are protecting the rights of our faculty members, staff, and also the way our university is structured. CU Innovations, our tech transfer office, has rights to IP as well. And so there are often times where we will pull in that office to make sure they are okay with IP terms that are not standardized, and making sure that, a sponsor is not going to have any more rights than they should have for a particular project. Make sure they're not trying to reach through and take our background IP, or have full ownership of something that we may invent while doing a study. Indemnification, which does, I think, sound kind of like a fancy legal term. It really just means that if another party were to be sued, the party that's indemnifying would step into their shoes and say, no, don't sue them, sue me. The best example of this would be if we were doing an industry clinical trial and we were indemnifying Pfizer, they were the sponsor. If a patient were to be injured and sue Pfizer, we would say, no, don't sue Pfizer, sue the university instead. Obviously, this is not something we want to agree to. It is something that, can cause a lot of liability down the road. So we rarely agree to this. Occasionally when we have to, it goes all the way up to the chancellor, and we actually report to the regents of the university how often we indemnify every year. So it is something that's taken very seriously, and something we have to negotiate very strongly. Subject injury also going to, happen mostly when we're talking about industry clinical trials. Who's paying for that subject injury? That's going to be, can be a point of negotiation, and something we have to be aware of. If we're testing a drug for Pfizer and they're handling the manufacture of the drug, we don't want to be on the hook if they manufacture the drug incorrectly or something like that. Billing and payment details, these are very important. Once we have an agreement, a fully executed agreement, that's going to be set up into our billing system, and we need to know specifically how we're going to handle billing and payment. There also can be times where a sponsor, or say we're getting a subcontract from another university, could put very quick turnaround times in terms of billing. They could say, we need your invoice in 15 days or we're not going to pay you. That's obviously going to be problematic. So we're really making sure that those billing terms are workable on our end, and that we're going to get paid, because we don't want to have to deal with not getting payment from a sponsor. And then payment terms and budget. Again, payment terms, making sure that those are both outlined and clear, but also appropriate. And then the budget's going to be pretty key as well. When it comes to the budget, we are relying on the department and the faculty to figure out what that budget is. Our office will review, the pre-award team will review budgets at the proposal stage to, give a second pair of eyes, make sure that we're following sponsor guidelines, the numbers add up, F&A is correct. But when it comes to the substance of the budget, making sure that we can do everything we're saying we can do for the price we're saying, we're going to really rely on the department to tell us that. When it comes to review, it's important to keep in mind that we can never execute a contract unless we have the scope of work and the budget complete. The scope of work, just like the budget I mentioned, we do rely entirely on the department to come up with that. And so, particularly if you're working with another hospital, one of our affiliates, making sure that you start both the budget process and scope of work kind of earlier on. There are times where a contract, the terms and conditions will be complete, but we're waiting on the budget or scope of work to be finalized. So again, just making sure that those are done, as soon as you can start on those. They can be complicated, particularly if we're working with another entity. So the sooner the better, and that will help kind of the contract move forward. One other thing I'll mention on scope of work is that having a detailed scope of work is very helpful and can cause or can prevent issues from happening down the road. There are times where my office has been asked to help deal with a sponsor where there's a disagreement over payment. A sponsor said, you did not do the scope of work. On our end, we're saying, no, we did the scope of work. And if the scope of work is ambiguous, it's really can be more difficult to have that discussion. And we want to be able to, articulate how we've completed what's there in the contract to ensure we're getting paid. I'll say the same thing goes for outgoing subcontracts, making sure that it's very clear what we're paying another entity for. We've had those arguments as well. We've said, you didn't do what we wanted you to do. The other entity said they did, and then we're kind of dealing with who's gonna actually pay for that work. So the more detailed, the better for those. Let's see. And then F&A. So F&A does come up often as a topic. This is a grid that we've put out. It's on our website that outlines the different rates that we've negotiated with the federal government for the types of research and where it's located. So the one thing that I'll mention that I think is really a good thing to keep in mind when you're looking at this and trying to think about what a rate should be is the background of where this rate comes from is us articulating to the government, federal government, in a very detailed way how we are using the space we have on campus. So there's a very long process. It takes over a year where the finance office is going around and looking at all the space on campus and giving an allocation of that space to research or other areas. And so when we do this negotiation, we're saying, look, here are all the buildings we're using for research. Here are the costs for research. And this is why the on and off campus is a different rate. So you're on campus, we're going to have more resource intensive, kind of costs, right? So if it's going to be in a building that's primarily for research, we're paying for the building, we're paying for the lights. We're paying for all those things that are, what we would call indirect cost to help facilitate research. If it's off campus, we're not going to have some of those same costs. So if we're going out into the field to do some work, or if something's primarily taking place at a hospital, then it's going to be, we're not paying for those buildings, we're not paying for electricity, so you've got a lower rate. It's also dependent on the sponsor. So the first group are going to be your federal, your state your state sponsors. It's the same as this is going to be a flow through for another entity. And then if it's research, you've got your research rate, depending on and off campus. Instruction has its own rate. Other sponsored projects, I do want to mention this we don't use very often, but it's really to capture times where something's a sponsored project, but it's not research. So a good example of this would be a federally funded grant where we're doing community outreach. We're not actually doing research, but we're still going through all the typical kind of sponsor project things that we would go through. So we're responding an RFP, there's a proposal, we're getting a grant agreement. But again, it's not research, and so it's a smaller rate. And then clinical trials are going to have the same rate as organized research when it's federal. Private industry is almost the same. It's the same with organized research, instruction, other sponsored. But the real key to remember is that clinical trials is going to have a different rate, both in terms of the percentage, but also in terms of the cost-based type. So in terms of percentage, it's assumed that, when we're talking about a clinical trial, it's going to be using a lot of resources that are not on this campus, though certainly there are on-campus resources as well. But that's why it's going to have a lower rate in terms of percentage. But because it's total direct cost, we are also including more cost in that percentage. I'm going to go into the next slide to go into that in a little more detail. But first, I'll go through proof of concept. So this is a very specific type of award. The only time I've really seen it is through the state of Colorado, where the Office of Economic Development and Technology is giving us a particular type of grant that has this 8% rate. And then associations and foundations, we do have a 10% rate for those, but that's also at that total direct cost. So when we're looking at modified versus total, the way to think about it is most of those types of contracts I mentioned, again, your federal grants are going to be at that modified total direct cost. So we're going to take the total cost, but we're going to subtract out things like equipment, patient care. We're only going to charge subcontracts up to the first 25,000. That's something that's very key to keep in mind. The idea being that if we're paying another entity $500,000, most of those costs are not going to be on our end, right? It's going to be on the subcontractor's end. So we're only charging up to the first 25,000 to recoup the cost it takes to process the agreement and manage the subcontract. As I mentioned before, clinical trials for this chart as well, we're following the NIH definition. So you can see that listed below under that first footnote. And then for the second, a little more detail on patient care charges. So this can be very nuanced as well. But when we're thinking about patient care charges, it's good to keep in mind what I kind of mentioned at the beginning, right? The key of, are these university expenses or are these expenses for another entity? So if it's something that's going to be at a hospital where they're going to be paying for things like their staff time, their equipment, the buildings, we don't want to have those costs built into the F&A rate that the university is charging. So again, very nuanced. And if you have questions, don't hesitate to reach out to get help with deciding what should be included or excluded in that rate. Just another slide with the definition of the clinical trial that we've gone through. And then here's another definition or really a regulation from NIH when it comes to patient care cost. Like I said, it's those hospital type expenses that they're trying to not be included in F&A. All right, I'm going to go through now some frequently asked questions that do come up a lot. So the first one is, who is legal counsel for these agreements? So my office, Christine's office, we are not legal counsel for the university, but we do have signature authority and legal authority to negotiate agreements on behalf of the university. We do at times bring in legal counsel if there's an escalation. The indemnification waivers, if those come up, we work with legal counsel to get that to the chancellor. But primarily, it's going to be one of our offices or the other ones I listed on the first slide that will handle the agreement. Who has signature authority? There's a kind of complicated and probably at this point needing to be updated signature matrix that's listed there. But really all the offices I've listed have signature authority for their particular contracts. How long do agreements take to finalize and sign? This is something that comes up often, but is very nuanced. It really, really depends on what the agreement is, what type of agreement it is, who the sponsor entity is, the volume of agreements. There are certain types of contracts that tend to follow a pattern depending on pattern for the federal government or different foundations in terms of funding. For example, subcontracts tend to follow some of the NIH funding cycles. So when the NIH is giving a lot of money to other entities, we, a couple months later, start to receive a lot of subcontracts from those other entities. That time, there's a much higher volume, contract time, turnaround time is going to be slower. I will say there are a lot of agreements that should be pretty quick, particularly agreements with other universities where We've come up with a template that's pretty standard. We don't need to negotiate often. That's going to be very different than a industry clinical trial agreement that, we're arguing about IP on, right? So it really depends on the sponsor, the volume, all those factors. And then other offices that we have to bring in to discuss, maybe CU Innovations needs to be involved, maybe legal counsel, as I mentioned. There are some agreements that don't fit cleanly into one bucket or another, and it takes 3 offices all having a conversation to get it done. So really does depend on what's happening there. Where can I get a contract template? So it's actually preferred if we can use one of our templates. Most sponsoring entities want to use theirs, but we will see where particularly smaller companies like startup companies will ask for a contract template. We're more than happy to provide those, and really does make the contract process a little bit easier if we can start with one of our templates. Another question that comes up is how do we work with our affiliates? So we're affiliates with UC Health, the adult hospital on campus, the VA hospital. Something to keep in mind when it comes to UC Health, the bulk of the research agreements and agreements in general related to our faculty effort are going to go through the university, or if it's those consulting agreements I mentioned, CU Medicine. When it comes to the VA, we will see a lot of faculty that have dual appointments there. They're, have an appointment at the VA, they're doing clinic work there, maybe research work there, but also have time at the university. We have what's called an IPA, where we are able to buy time one way or the other between us. And then a JPA, which is with the DRI, which is basically a nonprofit arm of the VA that handles some of their contracting that the VA can't deal with directly. But just to know that there are kind of interinstitutional agreements that we're doing with the VA to facilitate research. Children's is a little more complicated. We put together this flow chart to talk about who handles what with regards to research that's happening at Children's. So when it comes to these types of contracts, the key is going to be who is the sponsor, where's the money coming from. It's also the prime source of funding, and doesn't matter necessarily who we're contracting with. There's a lot of times where we'll see money flowing through another entity. We don't really care who the other entity is. It all gets back to where that prime source of funding. So if it's federal, state, foundation, nonprofit, then it's going to come to the university. So when that happens, the prime grant comes in to grants and contracts. We have what's called a master service agreement with Children's. This allows us to take those the federal, state, foundation, nonprofit grants or contracts, and then pay Children's without doing a subcontract, which is something that we came up with, I want to say maybe 4 or 5 years ago now. It's actually a really streamlined process, and has been really nice to do that instead of trying to subcontract at Children's. There are a handful of times where one of these entities will fund a project that does need to go to direct to Children's. This could be where one of those entities is only funding hospitals, or maybe they're only funding entities that have a trauma center, something like that. And in those cases, Children's can be the direct recipient. If that happens, then faculty effort comes back to the university through CU Medicine. But if we are receiving money outside of that, that's going to come back to the university as a subaward. This is very rare. It's a list of maybe 15 at this point, and is a little bit outside the normal process. So if this is coming up, definitely don't hesitate to reach out and ask about that process. When it comes to industry funding that's happening at Children's, Children's and the university enter into what we call a tri-party agreement with the sponsor. Tri-party just means that there's 3 entities that are signing on. Children's does take the lead on these. My office is not involved. This is going to be the CREO office. We'll review those, but it's really children's kind of taking the lead, and then the funding will come back, as I mentioned, through CU Medicine. And then if there's funding outside of that, the children's will use what's called a remuneration agreement to pay for things like equipment or supplies or staff that aren't part of CU Medicine will fall into that remuneration agreement. This can seem very complicated. I think most of these fall under the work order or the tri-party, which helps. But again, just reach out if you're kind of confused on how something should flow with children's. One other question that does come up a lot is how can I review the status of my contract? So this is specific to sponsored projects that are running through my office. But if you go into InfoEd, you can see the status of an agreement. So we go into what we call the agreements tab. We are documenting each piece of the process that's happening. That way, departments can go in and see where it is without having to send an email. So here's an example of one. You can see when it was received by our office, when it was assigned to the person who was reviewing it, when they reviewed it, when they redlined it. In negotiation just means we're working to negotiate it. And then when it was partially and fully negotiated, and then when it was partially executed, which means our office signed it. Here's a little more detail in terms of the statuses to help kind of give some definition about what those mean. Certainly you can still reach out with questions, but if you want a way to self-serve a little bit, that's one way you can see the status of those contracts. All right. And then lastly, I've included some links here for both of our offices. We have done a lot to update our websites and make sure that there's good information. It's a little more accessible, easier to get to, and that it's up to date. So that's been within the last year that we've done some good updates there. So don't hesitate to go and check that out. A lot of the things included on this slide are included on the OGC contracts page, along with a lot of other training materials and other really good kind of one-page charts that I think are very helpful when it comes to, having something handy for contracting. There's our website, again, called out the contracts page. I do also want to call out our sponsor projects training page. So this training was specific for this group, but we do have a broader sponsor projects training suite of trainings. So this includes pre-award training, post-award training, some human subjects training. There's another contracts training that includes a lot of what we talked to, but includes some other things as well. So, if you're relatively new or, wanting to learn about a particular area and sponsor projects, I really recommend those. We do them twice a year, so kind of on the semester basis in the fall and the spring, but also available to do ad hoc. So if you're in a department and you want, let's say, pre-award training, we have some folks that can come in and do training just for your department, or individuals who are new as well. Happy to be really flexible on our end and offer trainings in whatever way is going to be helpful for you or your office. All right, so that's a lot of information. I'm hoping some questions got answered in the chat, but we can open up to questions now if folks have some. I think we've got about 10 minutes, so right on time. Yeah, happy for me or Christine, the rest of the panel to answer questions.
I don't see any new questions coming in. A few have been answered either privately or publicly, just depending on how helpful it might be to the group. Christine, one question for you, although I think they're going to reach out to CREO as well in case there's more details here. Is there a difference between the MTA that Creo handles versus med oncology?
I think we need more information. If you're talking about a specific template for med oncology, is it incoming? Is it outgoing? I think there's a few details we probably need some more information about to answer properly.
Perfect. Well, they'll be reaching out directly, I think. Just thought maybe we could get an answer if you were familiar with what that was. New question, how should we handle sponsors who say they are only allowed to pay a certain FNA or no FNA?
Yeah, I can take that one. That's a great question. We do see that occasionally. The one thing I will say is we do try to be flexible when it comes to the federal government or nonprofits. So if the federal government has said we are issuing a grant and we are only going to allow, I don't know, 36% FNA or just kind of a random number, we will honor that. We will honor what rate they've said. When it comes to foundations, we'll do the same thing. So if Bill and Melinda Gates Foundation has said we're only going to give 8% for our grants across the board, we will honor that. We will not do the same thing for industry. So we want industry to pay the same rate as the federal government. This is something that's kind of come up politically in the past. I think even there was one point the federal government was looking at reducing FNA for universities because nonprofits have a lower rate. Thankfully didn't go through. But if an industry partner has said they will only pay a certain rate, the department does have the option to cover the rest of that rate internally. But we're still going to charge industry rate, the same rate as the federal government, really no matter what. There is a waiver process that you can ask for a waiver for industry, but I don't know that I've ever seen that be approved.
Great. We got another question. This one's probably for you, Christine. We are working with a new medical device vendor, and we need both a data use agreement reviewed and a procurement contract to be reviewed. Where do we start? Can those be handled at the same time?
So you can do these on parallel paths. However, anything that's a procurement, which is a purchase of a good or service, needs to be handled by the procurement service center. So you definitely want to initiate that project or that process, particularly right now. They're at year end. They're really coming up on, our fiscal year end is the end of June. So they do get slammed, as anybody who's doing a purchase may know. So I strongly recommend getting that initiated now. With respect to the data use agreement, it may be something that needs to be part of that suite of contracts going through PSC. We do collaborate with PSC pretty, on a regular basis. So you could submit that with that. But if it's actually a separate data use agreement, I think we need to look at that to make sure whether or not it needs to be part of the procurement piece or separate through Office of Regulatory Compliance. So you're welcome to send it to me if you want, and I can try and take a look at that. Then we would do like a parallel process for each of those.
We have another question about routing a CTA and how that might work with InfoEd and also all the other portions, if you wanted to speak to that, Christine.
Routing of CTAs is fundamentally different than routing a typical sponsored project. You may need to start with the human subjects portal. What happens then is once that is done, that you initiate that process. Our intake coordinator on a regular basis, really every day, gets a list of new projects that have been routed through the portal. We then assign that for review to the contract associate, kind of based on, it's more or less round robin. The next one up, then somebody gets that. We don't really use the InfoEd process until the end of that contract negotiation. If you have questions about different elements of a CTA, I would recommend looking in Encore because there is a contract task list in there, and that may give you the information you're looking for.
And I just do want to add, for even those CTAs that route to the portal, you will eventually need that info routing because that's what's going to drive getting the speed type set up on the back end. So like Christine said, that Creo is not really using InfoEd for anything in their processes, but it will be needed for once it moves kind of to the post-award stage to get a speed type set up. All right, I see Liz is answering one more. All right, I'm gonna try my best this one. Do capitated enrollment payments to subrecipient enrollment sites require a separate contract, clinical fixed rate, if the same site is also contributing to the research science? Can they all be incorporated into one cost reimbursable subrecipient agreement? I think I know what you're asking, kind of whether if you're going to have what I'm guessing are probably effort cost, but also fixed clinical cost. If that's the case, it's a good question. I think we probably could do that in one agreement. Liz, I don't know if you've been seeing that much on your end. I think I'll just say I think generally we tend to see one or the other. I don't know. Do you have thoughts, Liz?
Just reading through the question a little bit. And sorry, I missed your response, TK, because I was typing the response to that other question. I would say that usually for like enrollment-based clinical trials or some sort of enrollment-based or per patient costs, usually we can do a startup cost as a one lump sum that can be kind of the cost reimbursable part of that. But then any per patient or per, X like MRIs, that sort of thing is handled in that same budget. It would kind of just depend on what cost reimbursable lines there are. But I think, honestly, if you want to reach out to us when you have the situation, kind of tell us what's in your budget, we can advise from there and we can pick one or the other template to kind of guide which reimbursable or which line items are the most probative. So definitely reach out in that case. We can try to get that all in one agreement, I think.
Yeah, that's the only other thing I'd add is, we definitely try to have one contract where possible rather than having multiple ones. I don't know that I've seen where we've had multiple contracts with a subrecipient. So I think that's a good thing, a good suggestion, Liz, just to reach out and we'll kind of figure it out on our end. We've got one more. Our PIs continue to be confused and frustrated that industry-sponsored clinical trials have different F&A than other industry-sponsored clinical studies. So this would be the difference between the 28% total direct versus the 56 modified total direct. It's certainly above my pay grade and can appreciate the frustration. The one thing I'll just mention to that is because of that difference in the modified total direct and the total direct, I've actually seen where the kind of ultimate F&A that's charged ends up being closer than you might anticipate. If you have a higher modified direct, but we're taking out a lot of line items that don't count in versus doing that lower but encompassing the total amount. I've actually even seen where something was at the 28% total, but ended up charging more F&A because we had a lot of subrecipients that had high dollars that were flowing to them. So I don't know that is going to completely address the frustration, but just something to keep in mind is it's not just that first percentage, the total versus modified can factor in as well. All right, well, I think we are at time. Very happy to take questions from this offline. feel free to reach out to myself, Liz, Christine, any of the contact emails we provided. It definitely can be complicated, nuanced. We're a big university. There's so many different types of agreements, but we're all here to support and help, and want to help make the process as transparent and efficient as possible. I don't know if Ben or Trisha or anyone has a final sign off.
No, just thanks to all of you for this presentation, and as you said, if there are additional questions, just reach out to TK or Christine or to the appropriate email boxes. All right, thank you all.